Hello, my name's Pam Ferrer and I'm proud to say that I've been a Macmillan clinical nurse specialist since 2003. I was one of the first site-specific cancer nurse specialists within the Trust, and I'm now a member of a very large Macmillan clinical nurse specialist and allied health professional team. The role in 2003 was a new one, so setting up the service for urological cancers, of which there are 5: bladder, kidney, penile, prostate and testicular tumours. The plan was to be around for patients from point of diagnosis and heading until the end of the pathway. My role covers both surgery and oncology. My background is surgery, so I had a lot of information to find out about oncology, radiotherapy and chemotherapy, and I was lucky to spend time with the consultants learning about this. Communication and psychological support is a main part of the site-specific nurse's role, helping patients to come to terms with their cancer diagnosis and making decisions about their treatment and signposting as necessary. We developed patient information packs for each tumour site, not reinventing the wheel, and we borrowed ideas from other trusts. I have been involved in setting up Northampton Prostate Cancer Support Group, which started in 2007, and I'm lucky enough to be still involved with. I set up a prostate cancer clinic in 2006 and was responsible for leading this across the network. In 2008, due to the sheer volume of patients, Judith Fletcher was appointed as a second CNS within the uro-oncology service. Many more kidney patients were being diagnosed at that time and more treatments were being offered. Judith is also still in post. The role has developed over the years and the emphasis of the cancer CNS remains the same: to support patients and their family for as long as we are needed. As new post was set up in 2016, which came from Macmillan alongside the GP services to manage prostate cancer patients who had stable disease, and they wanted this to be the same across the county. Myself and my colleague Janine from Kettering were both asked if we would consider taking up the role, and this is a one that I'm still doing. The clinics were to be over the telephone, and this was the main emphasis of the service. But we decided to be inclusive, so if we had elderly patients or patients with dementia, we did go and visit them at home, and we also did a couple of face-to-face clinics per week. We also set up a wellbeing service. This was a session that happened once a month at Moulton Community Centre. It was with different topics for patients with prostate cancer, and it helped to the patients with their peer support. I have enjoyed my time as a Macmillan clinical nurse specialist. Our aim is to help as much as possible to make the patient's cancer journey better. I'm going to miss the patients. I will miss the patients a lot when I go.